people are still using fax machines.
Yes. We're moving, hopefully not from one buzzword to another, but actually, and they're using 3 to 4 to 5 FTE positions, employees, manually keying in.
Or that if you're not at the table, you're on the menu.
Tune in for today's episode of the Leadership Lab Clarity Special Edition.
Thank you for joining me for another episode at the Leadership Lab with Asbel Montes. This is a special edition because we are recording live from our 5th annual user summit called Clarity here in Laguna Beach, California. And I am ecstatic that Fred Wilkins is here with me from VLI. He's the president of VLI, and he actually is our title sponsor at our Clarity Summit as well. But tell us a little bit about yourself, Fred. Give us a little bit of background, and we're going to dive in because you're what I would call a data geek. So I'm really excited because that is what our construct here at this year is about: data, doctors, and leadership through the eyes of the patient. You're doing some yeoman's work in that space or whatever. Tell us a little bit about you, Fred.
Yeah, very happy to be here. I love what you guys at Solutions Group are doing and the opportunity to partner with you in some of your initiatives. And myself, I've been in EMS for over 35 years.
We're dating ourselves, right?
I know. I started it as an EMT as a means to pay my way through college. And between sitting in university classes and sitting on an ambulance, the ambulance won. And I started it just a way to get through college and immediately knew that's all I ever wanted to do with my life was be an EMT and then a paramedic. Did that for many decades. And as I grew and changed in my position and my role in EMS, I began to realize there's a lot more to our profession. And I really began to grasp on to the differences from the hospital aspect, where I spent a few years in the emergency room in the late 90s, early 2000s, working as a paramedic, when it was a challenge to be a paramedic in an emergency room. And then I realized that models of healthcare were different. One of those key roles that played a difference was data and lack of data in the EMS profession and the fragmentation of data in the EMS profession.
So tell me how you got started with the data. So being an EMT, a paramedic at service, so I'm not surprised that once you got into it that you felt a calling to this life of service. But tell us how that started, how you got into the data, how you then started your own company and VLI. Yeah. Tell me about that.
I accidentally got into data and to being a geek. So one of my times when I was in a hospital, working in a hospital, I worked for a company called Medcath Corporation. And they had an interesting mindset. They decided to open heart hospitals that specialize in only heart care. And that's where I got a job in the emergency room. Their model was different in that they believed that everybody that worked in the organization should have the ability to fill 2 roles. So not your primary clinical role, another clinical role, or even another department role. So there was always that backup of personnel. At the time, that was quite different. If you were a nurse, you were a nurse. You're a paramedic, you're a paramedic. You didn't do anything else. So they actually did some testing and some stuff like that. And I ended up showing an aptitude for technology. So I would spend time working on technology issues when I didn't have a paramedic, I didn't have a patient in the emergency room. So that kind of changed my career path. And then I began to realize what was happening from a technology standpoint. That really affected me in EMS because when I stopped working in the hospitals, went back to the field and operations full time, I realized we had a different level of technology in EMS, in pre-hospital settings. At the time when I made that first change, we had very little technology in pre-hospital. We had a dispatch system of software, and we had, which there were very few at the time in pre-hospital care. We had the ability to link into some medical records. We did it by paper and faxes.
Paper and faxes,
yes.
And that was not very long ago.
Well, yes, sadly, that was when I started in the late 80s and 90s, and I still have customers today that come in the door that are sending faxes today. So
Tar, let's talk about, I want to talk about that a little bit because we're talking about the evolution of data. We're talking about interconnectedness and interoperability and how HIEs or health information exchanges are going to help. I mean, this has been something, and I've been in the industry, I've been doing advocacy work for 29 years, and we've been talking about HIEs for, dear Lord, this was probably a lot around the ACA that came out kind of trying to create this. I mean, but we're 20 years in and still talking about this, and you still have people faxing. I'm intrigued to know from that piece because you're like, today in 2026, people are still using fax machines.
Yes.
How is that, and why is that continuing to happen? In your opinion, I understand there could be some whatever, but tell me from your opinion. I'd really like to understand that.
Yeah, it still happens in many cases because the technology that is being used by our EMS providers are somewhat siloed still today. They're not integrating. Medical records are a great example of that. There's very little integration as a whole with the healthcare framework. All the rest of healthcare, really in the world, operates off a framework with the back end of HL7, and then that integration through health information exchanges. Besides the regional state ones, there's some national ones. Epic itself, which is one of the largest EMRs in hospitals, is actually their own healthcare exchange with the volume that they have and what they do. Pre-hospital healthcare, to this point, from a clinical standpoint, there are integrations from our individual silos into that EMR system, that HIE. But right now, it's still largely just a small data dump of certain select items, certain clinical items. In many cases, are still attached as an image or as a PDF with a header for that patient. That's a stark difference. When a patient walked into me in the ER in the 90s, and I put some basic information in our system then, I knew everything about that patient. I knew what medications I should be careful of because of the medications they're on. I knew what their medical history was, and this could be leading towards their prior history of myocardial infarction they had 6 years ago, things like that. Whereas today, a paramedic walks up and may have a name of a patient, may even know the information from a patient, may have a conscious, alert, and oriented patient that can share with them, but still doesn't really have their medical record, doesn't know immediately what medications they may be considering using on that patient that could be a danger because of the newest medication their family doctor put them on. So that's still fragmented today, and that's still having systems that are faxing records into hospitals. I have hospital customers that I work with that even though they're a hospital, their hospital-owned ambulance system is using a medical record that's separate, not integrated with them, and they're using 3 to 4 to 5 FTE positions, employees, manually keying in the pre-hospital care report into the Epic system so they can bill. So that even today, there's still that fragmentation when they actually own their own ambulance service and operate that provider. So that's one of the things that gets me going.
So I love it. So we're going off here. We had an outline, folks, that we were going to go through, but we were just about to go off script. So let's kind of talk through what you were just talking about, and I want to talk about AI because that's a part of our conference theme. We're talking about the legalities of it, but I don't even want to talk about the legalities of it. How do you think the use of AI, whether it's closed or open, is going to start maybe help to streamline some of this thing where we're using 4 to 5 different individuals to manually key stuff in? This is something that, generally speaking, can be done through some type of agents or whatever. What are you working on? If you're working on something, talk to us about how healthcare can evolve into what I call modern healthcare. That's where technically this administration is looking like, how do we modernize healthcare? There's initiatives happening right now that they just put together. HHS and Secretary Kennedy and Dr. Oz have put together kind of a new FACA committee that is going to be talking about modernizing healthcare. Tell us how we can do that here in EMS.
Yeah, I believe that AI, properly used, can be that bridge to get the individual silos, that fragmented data layer, into a format that can be consumed quickly and easily with other healthcare providers in the healthcare system. I believe it's a bridge product. I don't believe we should all stay where we're at with our current technologies and softwares. I believe that TechScape has to change and modernize so that we can have that true interoperability that it's a buzzword for years. Before we had AI, the buzzword was interoperability. Every conference you went to, every session was about interoperability. The last 2 years, every session talks about AI. We're moving, hopefully not from one buzzword to another, but actually truly eliminating the fragmented service layer, those data silos that we have. AI can help us do that quickly and efficiently. AI can help our clinical caregivers give better care and do backup for them on decision making, looking at all the possible contraindications of a medication or a treatment or something they're going to do. I believe AI used in that model is very beneficial to healthcare and very beneficial to pre-hospital healthcare.
So let me ask you this. What is your company doing? What are you doing? Because you're kind of thinking through that, getting rid of the layers and the data silos or whatever. What is your company intentionally doing? Or we will just continue with this artificial stuff, and maybe that's what people want to do. I'm talking about more, I'm speaking to builders. I'm done with talking to critics and people that just want to keep being on the hamster wheel of
Yep.
healthcare. But let's talk to builders that do something different. Disruption's scary. I don't care what you think about this administration that's here now. They're disruptive.
Yep.
That's what it's all about. It doesn't matter what you think. I don't care what part of the political aisle you're on. This administration is disrupting.
Yep, absolutely.
What are you doing at your company that says, you know what, we want to get out of this data silo? Can you share with anything that you can say or talk about?
I spend a lot of time with our partners that we work with, other software agencies, that we work with our customers to integrate that to flow so we don't have overlap in what they're doing. But I spend a lot of time pushing my partners, almost painfully at times about what they're doing. Why is their product advancement still staying in this segmented data model? Why is your next thing you're doing on the what's ahead for us on your roadmap is not a refinement of what you have? Because it's been the same for 20 years. And so we don't want to refine that. We want a new technology. We want something that eliminates, if it takes 15 pieces of technology to run your pre-hospital system, we truly want 3 that'll do it in the future. Completely new architecture, models that fully integrate, that when you have that bedside encounter, you know everything about that patient, that you've segmented that out, that you've addressed your data collection, you've addressed your revenue cycle in that model, so that as your patient is bedside, the dispatcher has already identified that patient. You've already got medical records coming to your PCR that you're using, whatever that may be. And as you're doing that in treatment, your treatments are going to the emergency room, live, real time, building that patient profile in their medical record. And then from that point on, as you get to your destination, then your demographics are released, your revenue cycle stuff is released, your payers are released to the revenue cycle side of every provider, whether they be independent third parties or whether they be private, whether they be public, they get that information there. So we spend a lot of time showing our customers how their systems should work together, and then also pointing out to them, here's a new system. It's going to replace 6 of your systems now, and it's going to stop that fragmented location. We started from the data side. Our core product when we first started at VLI Tech was our Vanguard mobile manager. And what we did there is we said, you're using 10 systems that are all data-based and technology-based. None of them talk to each other. You have to run reports in 10 different places. That was the first thing we did. We said, we're going to take those 10, we're going to take the 10 most important pieces of data that you have from those 10 and put them live real-time in front of you on an app on your new iPhone that you just got, and you'll be able to make quick decisions live today. We're about live decisions in the field right now, or in the dispatch center, or in the operations area. So that's what we're doing, is driving people to think that way, that I don't have to have 15, 20, 30 different systems to do this.
This episode is sponsored by Solutions Group Services. Baseball isn't won at the plate. It's won in the scouting room. Long before the first pitch, when someone spots the opportunity nobody else sees. Healthcare reimbursement works the same way. If you're billing Medicare, Medicaid, or health insurance on accident-related claims, you're leaving money on the table. Auto accidents, workers' comp, slip and falls, those are liability cases. There are no deductibles or co-pays to contend with, and they pay significantly more. The problem? Finding the liability claim information usually means chasing the patient. Voicemails, dead numbers, a referral to their attorney who never calls back. Our TPL Discovery technology finds active claim information for third-party liability on 44% of the claims we scrub. No patient phone calls, no attorney chase, just revenue you're not capturing today. You don't need a bigger swing. You need a better scouting report. Solutions Group Services. Solution givers, not crisis managers.
I can consolidate and do it under one,
Yes.
which I think that's the modernization that needs to happen.
Yes.
And it's going to take individuals that are not going to let perfect be the enemy of good and
Yes.
get out there and say, there is a way to do this. That's disruption. It's what I like. It's what I like that you're doing. To that point, I'm going to not pivot here too much, but this is where it usually gets in. And I talk about this. I'm a policy guy. I mean, I've known policy done it for years, but I always know that you always have a great concept or there's a great policy and then politics gets involved and it becomes good. And recently what's happened is, and I didn't even realize this was happening until I'd had a conversation with you and I believe Ken Jackson. I hadn't met him before,
Yes.
but you called a meeting together, and you guys have been doing some different things. I want you to walk me down why you decided to get involved in some of the political environment or the policy side of it, and what was that triggering moment that started this journey?
I was invited by Ken Jackson to a political event as a guest of his for my company. And when I went there, I was thinking politicians. Well, it could be interesting. It's an entertaining show, right? Politics are very entertaining. I've later described this as I understand. I actually really like politics, and I like the structure of the government, the organization, and I realize what it is. It's just like being a paramedic, but there's usually not any blood. It's chaos. It's rapid fire, and decisions are being made quickly. Things are changing. I think that's why I started to like politics so much. It just tied me back to my early days as a paramedic, never knowing when you're on that call what you're going to show up and get. Same thing on political events. You never know when you walk in the door what's going to happen or what you're going to get. But I was really drawn to it because I really wanted to, after the first event, it wasn't to meet the politicians and see the politicians and hear what they're doing and what their goal is, which is important for all of us to have that. But it was really to meet the other entrepreneurs and business owners that were in the room, because I felt at VLI Tech, and specifically at pre-hospital and EMS in our profession, we had a real disconnect, not just from a data standpoint, but from a business model standpoint. Of how you do business. How do you work with policy? How do you talk to people about policy? How do you work in politics? The lobby of pre-hospital that's available has traditionally been a very small group of lobbyists, a very small funded group of lobbyists, and that's why we started doing this on our own as a company, and a couple other companies have invited other customers of mine to some different events to get them involved. Because if we're going to sit at that table with hospitals, they're getting their policy stuff done all the time. I love fire departments. It's a great example of it. The fire department and firemen lobby is huge, especially compared to pre-hospital care. And there's been an identity crisis in EMS. What are we? Are we a profession? Are we an industry? Are we healthcare? Are we transportation? As that comes together and we decide on our own what that is, if we aren't involved in the overall policy decision-making process and the political process, no matter which side of the party you're on, I go to both. Okay, I have the same crazy conversations of both, and I have the same great conversations of both sides of it. But you have to be invested in that. And I took out of that, when I get done with it, I pass it on to my customers. Hey, I heard about this in your state. This is going on. Do you know this is happening? Hey, we went to this, and they're looking at these policies. They're looking at some big changes from a CMS standpoint. Are you involved in that? Are you calling anybody? Are you talking to anybody? So that really was a surprise for me. It wasn't a planned migration into that area. It was, again, Ken invited me, and I realized there's a lot more going on here than doing fundraising for the next campaign. Yeah. That's not just what's happening.
And I'm glad you're doing that, Fred, and I think it's really important for our listeners to understand that it's what we've said all the time. I mean, I've said it all the time. I heard this from a mentor that if you're not at the table, you're on the menu. And I'm a builder, so I want to design the menu. I don't want to be eating off someone else's menu, because that's generally what will happen if you're not at the table. And so I like that you're doing this and you're getting more involved, because once people start understanding this is really how the sausage is made, okay, I get it. And many times we abdicate our voice to others. But in this modern day of podcasting and talking, what happens is the voice can get out. There can be a conversation, but then you've got to weed through filters. You got to read through people that are trying to manipulate conversations and discussions or whatever, but to really get down there and hear. And so when I heard that you were doing that and really getting involved, and I'm like thinking, this is good. We need more and more individuals out there having a discussion so we can get to consensus and generally talk. You made a statement here right at the very end of your thing about it doesn't matter what room I'm in, I'm paraphrasing what you said, regardless of the political lens, whether you're a Republican, whether you're a Democrat, the conversations are kind of the same.
Yes.
The issues are still kind of the same. Now, there's the way that they get to solutions might be different than what I like or not, but the solutions are generally the same. And when I get there and sit down to really listen to what people are saying, to really listen to hear, not to respond, I probably will agree and get to probably 85 to 90% on both sides of the aisle. The problem is, if I allow that 10 to 15% to shut down where I don't hear you anymore,
Yeah.
we can't solve the problem. So I love that you're getting involved and you're doing that. And then you're passing it on to your customers. You're passing it on to your partners that you deal with as well. So as we're kind of wrapping up here, I wanted to I like to ask this question of a lot of my guests. And I want to ask, like, what keeps Fred up at night? With everything that's going on with the topic, it doesn't even have to be the topic of what we're discussing now, but what literally keeps Fred up at night? What's one thing that keeps Fred up at night?
I think a lot about leadership fatigue in pre-hospital care. The executives that we deal with, that you deal with, are phenomenal, do some great things. They're driving healthcare in the different regions. But I've seen a growing gap between that executive level and the operations level of the organizations. I've seen an exodus over the last decade where you're really strong young employees that become obviously interested in leadership or have that ability to move into leadership. They're jumping out of EMS and they're not staying there as a career. I think we've lost the ability to craft the career focus of what pre-hospital care is for the generation that is coming in now or that's been in for 5 years or 10 years. And my concern is when these executives age out or decide that they're going to take more time with their families outside of EMS, is that strong person below them that shares their vision, that understands their vision and will keep driving the provider, the paramedics, the crews, the staff towards that goal of taking care of the patient and also being a successful business. That concerns me as I spend more and more time with executives and looking for who's with them and then working with companies. That gap concerns me at night about pre-hospital.
Fred, thanks for bringing that up because that's important. And I think we're seeing a lot more focus on leadership. We can have all the tools. We can have the data. We can have the technology. We can have the doctors and the physicians. But if we don't have the leaders because they're burned out and saying this just isn't worth it to us anymore, we cannot take care of the patients. And so thanks for bringing that up because I think that's really, really important, the leadership dynamic that we need here. Of course, I'm on a grace leadership thing right now that I got to give grace to myself before I can give it to others. But that helps with the burnout when I understand the word of no, the power of the no.
Yeah.
And that's what you're saying, that you're seeing as these executives and as we start to transition, what's that going to look like? Makes us nervous that those of us that are getting older, because this younger generation that's coming up, they lead differently.
Yes.
Doesn't mean it's wrong. They just lead differently, and we have to begin to think differently. So thanks for bringing that up. What a powerful way to end this podcast. And Fred, thanks for coming on. Thanks for being involved in this special edition. I'm loving it here in the studio, but thank you for coming on. We'll have to do this again.
Yeah, absolutely. Thank you.